Hi, my name is Tunde. I'm an ENT registrar in the Northwest region. Currently working at Stepping Hill and covering on calls at Wythenshawe Hospital.
What was your pathway into ENT?
So my pathway was a traditional pathway actually. So I went completed medical school, completed my F1 and FY2, applied for core surgical training, and then applied for the ST3 6-year training program. I went through straight through.
And could you explain the training pathway to become an ENT consultant? So some of the main nodal points.
So just the ones I've just mentioned, you apply for core surgical training. Last year they started a pilot for run-through training. So that would be an ST1 all the way through to ST8. I've taken the more traditional approach where you go through FY1 and FY2, core surgery 1 and 2. And then you apply for ST3 competitively nationally, and you get an ST3 through to ST8 registrar training program. Following that, you become a consultant.
What sets ENT apart from other surgical specialities? What's special about ENT?
What's special about ENT? It's just the best. No, it's great. My personal reasons, and everybody has their own personal reasons, are that ENT has such a wide breadth of patients that you see. So you see elderly patients with sort of hearing problems, children again also with hearing problems. You see everything in between. There's a good opportunity to specialise in one of the sort of 6 subspecialties. So facial plastics, rhinology, head and neck, otology, peds, and laryngology. And within each subspecialty, you have the opportunity to subspecialise even further. So I think that appealed to me because I'd like to be a super specialist within a certain area in ENT.
So are there any negatives to the specialty in your perspective?
That's a tough question because you're asking the person that loves his job. I think the challenges I found in ENT are probably general to medicine in the time that we are practicing. So, there have been a lot of changes afoot in terms of the way rotas are run, the way we're paid nowadays. I think those are really more the challenges I face rather than the actual workload or work cases that we are seeing. I think that's just generally what we're seeing for junior doctors as a whole at the moment.
So could you describe a typical day as an ENT registrar?
Okay, so typically you'll find the ENT registrar either in a clinic, in theatre, in some places sometimes doing some ward work. We may also have some admin sessions or research that we're getting on with. So for example, my current week is on a Monday. I have an operating list in the morning and one in the afternoon. On a Tuesday, I'll have a clinic in the morning and admin or study session in the afternoon. On a Wednesday, clinic in the morning, theatre in the afternoon. Thursday, theatre all day. On Friday, clinic in the morning, and then admin and paperwork in the afternoon on Friday.
What are some of the weekend commitments like?
So, depending on where you work, you'll be on a rota with other registrars. So you might be on a 1 in 5 all the way up to a 1 in 12 in some places. Weekends on call. When I'm on call, I cover a big teaching hospital and 2 DGHs as well as several GP out of hours walk-in centres. You're expected on a weekend to do a ward round at any admitting sites that you have. So currently I'm at 1, but my last job I had 2. So you see all the inpatients and any emergency cases would need to go to theatre following discussion with your consultant. You may also be expected to take referrals if you don't have an SHO who takes referrals for your specialty at any sites. And generally just manage the patients and ensure that they've been managed appropriately and they will get the safe and effective care that they deserve.
What skills make a great ENT surgeon?
Well, a great ENT surgeon, in my opinion, should first and foremost be able to perform surgery safely and to an excellent standard. There are other sort of domains that you would expect to excel at as a surgeon. So you should be an excellent teacher, in my opinion, because without good teachers, you can't have a new generation of surgeons coming up and giving excellent care to our patients. You should be a good manager. You should be able to manage your department and not neglect the fact that you are providing a service, and you should be able to reflectively look at yourself and your service as a whole and make sure you're performing to the best standards that you can do.
What advice would you give to medical students who are thinking of doing ENT?
Be keen, persevere. I found as a medical student that lots of people in ENT are friendly people, very busy people, so registrars and consultants generally are very busy, and you have to be very proactive. Okay, so if you are fortunate to find someone who will take you under their wing and find a mentor, then if they give you work to do, then do your very best to complete it, and that will always lead to more work and more things and CV opportunities and actually more experience within the specialty. And ultimately, that will set you apart from your colleagues when you're applying for ST1 or ST3.
Do you have any particular areas of interest in research in ENT?
So, newly developed, probably in the last few weeks actually, I've decided to look more towards the rhinology side of things, and I'm currently speaking to some of the consultants within the region about research projects.
Okay.
What are your interests outside of medicine?
I like climbing, and I've got a plan to go up to Everest Base Camp next year. So mainly climbing, watching football. Nothing exciting.
How tough is core surgical training? Is it easy to have a good work-life balance, or is it really as tough as people say?
Depends what you call tough. You know, I didn't find it tough because I had an eventual goal in mind. I don't know, I can only speak to my experience. I didn't find it tough at all because I managed to get a themed core ENT job. So I was doing ENT, which I loved, or I was doing an allied specialty, and my mindset was that I'm going to get the best out of this specialty as it applies to ENT eventually. So it's not easy, and it shouldn't be easy for you to get, a job in ENT, because we want the best people coming through, people that are going to push themselves, that are going to push the specialty forwards, and we need to have people that have resilience as well. Okay, life is not easy, and so training again is just mirrors life. You have to be able to take on the battles and challenges that come with the good days that you get in your job.
Okay. What are the time commitments like as an ENT registrar?
Work-life balance. I say it's amazing. It's great. It depends what you're comparing it to. It's not that if you're a GP, your life is, your work-life balance is awesome. If you're, in A&E all the time, then it's not so great. But I think you've got a happy medium. Personally, I think you've got the potential to enjoy your life outside ENT, outside your work. Even when you're on call, you do non-resident on call. So actually, sometimes if you have a quiet weekend on call or a quiet evening and you're not called, you can get on with any work you want to do. You can socialise with friends as long as you're within half an hour from the hospital. So actually, does it really impact your work, your private life that much? No, because a lot of doctors are on rotas, and compared to other specialties, actually, I think it ranks higher than most.
Okay. Thank you very much. Those are all the questions. Thank you.